Hello, good day everyone. We ended up our lesson last time on the introduction to nursing theory and the history of philosophy and science. So today I will be discussing with you the structure of nursing knowledge. Okay, so in this code presented here in the PowerPoint, it says or it states that the character of the nurse is as important as the knowledge she possesses. Okay, so what does this mean? It just simply means that how you act in an area, okay, kung paano ka gumalaw sa isang practice sa halimbawa sa hospital depends on how knowledgeable you are. Okay? Nakadepende kung gaano karami yung alam mo. Kung hindi ka masyadong alam or wala ka masyadong alam sa area, say for example na na assign ka sa OB ward, okay, and then wala ka masyadong alam sa about maternal, okay, or sa mga buntis, then hindi mo masyadong ma-apply yung mga nursing care mo or nursing practices mo kasi you are not confident enough, okay, to perform such procedures in an area that you are not knowledgeable. Okay, so this is how the structure of nursing knowledge will be developed. Okay, so paano ba na-develop itong nursing knowledge? Okay, so let's start. So according to Fawcett, 2005, she placed the nursing knowledge into a structural hierarchy with 5 components. So ano itong 5 components na yon? Okay, so we have the meta paradigm, the philosophy, the conceptual models, theory, and middle range theory. So throughout this discussion, we will be explaining each of them later on. Okay. Okay, so what does knowledge hierarchy mean? Okay, so when we say hierarchy, it is a hierarchy in which level is a whole, but is also part of a larger. Okay, and each holon or node, yung itong nasa sa loob, yung mga circles na ito, okay, functions independently, but also interacts with other holons or nodes. So, ano bang intindi natin dito or what does it mean? So when we say hierarchy muna, we have to define what hierarchy means. It means or it pertains to a scheme or rank or order. Okay? When we say hierarchy, yung pagkakasunod-sunod. Say for example, meron tayong hierarchy na order sa officials like president and then vice president, secretary, treasurer, etc. Okay? Yan yung hierarchy. So from the top, okay, down to the bottom. Okay? So if we say holarchy naman, it shows an order but one part belongs also to the whole unit or entity. Okay? Isa siyang unit or isa siyang part ng malaking unit. Okay? Paano natin ma-explain yan? Say for example, i-explain natin or example natin yung isang cell. Okay? Di ba yung cell maraming parts like na mitochondria, the nucleus, ribosomes, and etc. Okay? So, si nucleus meron siyang sariling function, pero it is still a part of the cell. Okay? So, like mitochondria din, meron din siyang sariling function, pero still part of the cell. Okay? So each of them have different roles and work independently but still are a part of the whole, which is the cell itself. So yan yung pagkakaintindihan natin ng holarchy. Okay? Okay, so what are the different structure levels? So we have the first one, the meta paradigm. Okay? So meta paradigm is the most abstract view of discipline and it consists of the concepts that define the discipline. So it means that the meta paradigm has a set of principles or ideas that provide structure for how a discipline should function. Okay? So in nursing daw, ano yung mga meta paradigm sa nursing? Okay? Or ano yung mga concepts na nagde-define sa isang theory or yung focus talaga sa isang theory. Okay? So in nursing, the most common meta-paradigm concepts are human beings or which is also named as the person in TFN or in some theories. Okay? Human beings or the person, environment, health, and nursing. Ito talaga yung 4 na focus ng isang theory. Okay? And each of them have different meanings in different theories. Okay? So, may ibang theory na adaptation theory, So, iba-iba din yung kanilang definition ng person, environment, health, and nursing. Meron din sa environmental theory ni Florence Nightingale. So, iba yung meaning ng person sa environmental theory doon sa person sa adaptation theory. So, we will be discussing those later on as we are going to start our discussion on the different theories. Okay? So, nursing is accurately classified as a discipline or a distinct way of viewing all phenomena. So, each concept no, under the meta paradigm may be defined differently depending on the nature of its theory. Kagaya ng sinabi ko kanina. Magkakaiba-iba yung definition nila depending on paano siya ginamit sa isang theory. Now we have here the concept. So, ano ba yung meaning ng concept? Concept is the idea that brings diverse elements into basic relationships. So when we say concept, it comprises of a group of aspects or ideas that when you combine them together, they form a concept. Okay? For example, or in simple words, ito yung mga ideas mo na nagde-define sa isang concept like, for example, ano ba yung concept mo sa taong strong woman or ano bang concept mo sa isang strong woman? Okay, merong iba na yung idea nila or yung concept nila sa na matatawag yung isang tao na strong woman is that single parent siya, kaya niya ipagtanggol or buhayin yung kanyang anak without husband, okay, or without a partner, ganyan. Meron ding iba naman yung concept nila ng isang strong woman is yung woman na gumagawa ng mga works na masculine na works or mga panglalaki na trabaho like nasa military siya, ganyan, or um, or isang woman na nagda-drive or isang driver, ganyan. So, iba-iba yung ating concepts, no? So, yan yung meaning ng concept. Now, the concept is also something that is understood or retained in the mind from experience, reasoning, or imagination. So, through correct reasoning or kung tama yung ating pagkakaintindi, it may be due to what you have experienced. Okay, yung concept mo is maybe due to what you have experienced or you can make your own concept. Okay, so for example, one has a different concept of how you define a healthy person or magkakaiba-iba tayo ng pagkaka-define ng isang healthy person. Okay, ang meron isa na baka mag-define siya ng healthy person na as someone who is or it will involves wellness in physical health, in physical, mental, emotional, and spiritual aspects of a person. So, matatawag mo na healthy yung person kung healthy siya physically, mentally, emotionally, spiritually, and minsan nga yung iba nagkakaiba-iba yung mga ano nila psychologically ganyan. Okay? So ganyan, merong ibang concept na ganyan yung concept nila as healthy person. Whereas meron ding isa or may ibang tao din na baka ang concept niya is matatawag niya na healthy yung isang tao as long as wala siyang sakit. Yun lang. Simple lang yung pagkaka-define. Okay? So as long as there is an absence of infirmity, then you can define someone as healthy. Okay? So someone can have that kind of concept in mind. Okay? Okay, so what are examples of concept? So we have here the health. Okay, sa health, yung concept ng WHO or the World Health Organization is that it is a state of complete physical, mental, and social well-being, not merely the absence of disease. Okay? So, ayon sa WHO, yung concept nila ng health is that hindi necessary na wala siyang disease, matatawag mo na siya na healthy. Kailangan daw, it is a state of complete physical, mental, and social well-being. Okay, ganyan yung concept nila as for health. Okay, for the self naman, ayon naman kina Craven, Hernil, and Jensen, okay, their concept of self is that a person's unique dimensions, potentials, and purpose. Okay, so yan yung pagkaka-define nila ng self. That's their concept of self. Okay. Now we have here the nursing paradigms. Okay. Nawala dito I don't know bakit nawala ito. Pero yung dito na part, okay, dito na area is, isusulat ko na lang. So, in this box is the, or in this part is the, sorry, nursing. Okay? Nursing. Okay? So, di ba kasi yung nursing meta paradigm is, it composes of nursing, person, health, and environment. Okay? So, si nursing yung pinaka-focus ng nursing theory. Kasi of course, we have these nursing theories will guide us on how to care, or ano yung mga approaches natin to care a person. Okay? Or how would nursing help the person's health? Okay? How the nursing would modify the person's environment. Okay, kagaya nung sinabi ni Florence Nightingale sa kanyang um, environmental theory na yung focus niya is the environment of the person, okay, of the patient towards recovery. Kasi nakaka-benefit daw ito sa pag-recover ni patient. Okay, so now let's define the different meanings or different nursing paradigm. Okay, so the first one is the person. Okay, ano ba itong person? It refers to all human beings. Okay? And those are, yung person daw is also a recipient of care. Okay, when we say recipient of care, yung tagatanggap ng ating alaga. Okay? So they are defined as the person in the nursing theory. Okay, and it also includes individuals, families, communities, and groups. So, hindi lang naman isang patient yung ating inaalaga, di ba? Kapag nag-alaga ka ng patient, isali mo na rin yung kanyang family. Okay? We also have communities. How do we provide care in communities? We have the community health nursing. Pumupunta tayo sa area ng community or sa depressed area to diagnose or to identify yung mga problems na kailangan i-address doon sa community. For example, wala silang proper sanitation or wala silang clean na water, then we have to address those. Okay, we have to make recommendations kung anong gagawin nila para magkaroon sila ng clean water. Okay, so you will be having that also in your second year. Okay, hopefully if you will be on your second year, you will be exposed in the community if permitted na, okay? Or if pwede na tayo mag-expose doon sa may community. Pumupunta talaga tayo sa community and nag-i-interview ng mga families, okay? Now, the next one is the environment, okay? Ano naman yung meaning ng environment sa nursing paradigm? Okay, so the environments are the factors that affect individuals internally and externally, okay? So we have those two environment. We have the internally and the externally. Okay, ano ba itong meaning ng internal? Si internal environment or yung environment within ourselves, okay, are those na can be your psychological state, your physiological state, and spiritual. Okay, kung halimbawa, nagkasakit ka, then na-affect yung internal environment mo. Okay, or kahit yung mental state mo, okay, na-affect yung internal environment mo. And about sa external naman na environment, okay, yan yung mga environment na outside sa ating or outside sa ating aspect. Okay, say for example, yung physical environment natin, yung ating school, ganyan, yung ating bahay, okay. If for example, marumi yung ating bahay, then ma-affect talaga yung ating wholeness or ating integrity as a person, okay? Kung usually kasi kung marumi yung bahay, parang nakakawalang gana mag-ano, 'di ba? Tumira doon sa isang bahay na magulo at marumi. So, na-affect yung ating environment na yung external environment, okay? So next is, yung environment naman is not only the surroundings but also the settings where the nursing care is provided. Okay, for example, kung na-affect yung environment natin, paano ba tayo ma-react sa environment or kung ma-threaten yung ating environment externally? For example, halimbawa yung lalaki, nagpa-catheter, okay? Pero yung available na nurse lang, or I mean, yung babae pala na nagpa-catheter, okay? And then, pero yung available na nurse is lalaki. Okay? Of course, mahihiya talaga yung babae na magpa-catheter sa isang lalaki na nurse. Okay? So, na-affect yung kanyang external environment. Okay? So, kung ayaw niya magpa-catheter, baka maano siya, hindi pwede yun, hindi siya pa-catheter kasi baka hindi gumagana yung kanyang o hindi siya makaihi, tapos nahihiya pa siya magpa-catheter sa male na nurse, so ma-affect talaga yung kanyang health niya. Madedelay yung kanyang recovery. So, what the person would do or the female patient would do is to ask for a female nurse as well. Para hindi naman sila mahiya, okay, na makatheter, right? Ano sila, malagyan ng catheter. Okay? However, kung baliktad, say for example, babae naman yung nurse and then lalaki yung patient, okay lang naman yun, 'di ba, sa mga lalaki na patients. Okay? Pero mostly talaga na mga nakaka-problem sa pag-insert ng catheter is kapag babae yung yung patient pero lalaki yung nurse. So ganyan talaga. Mayroong mga ethical or moral considerations about that. Okay? Pero mayroong iba naman na okay lang din sa kanila. Okay? Now we also have the concept of health or the meta paradigm, which is the health. Ano ba yung health? So the health is that it addresses the person's state of well-being. Okay? So since we are nurses naman, okay, and our nursing theory focuses on promotion of health, the focus of all our theories will be learning with ano yung nursing na pertains to care that we render to all of our patients. Okay? Yung towards the health of the patient, our focus would be how to recover fast our patients, no, or paano natin mapapadali yung kanilang recovery. Okay, sa nursing naman, it is the central of all nursing theories. Okay, since we have the nursing theories, of course, we will be talking about paano yung mga approaches natin of caring towards our patient. Okay, so ganun yung nursing. So it describes what nursing is and what nurses do and how nurses interact with the clients. Okay, there are two types of diagnosis kasi. Okay, um, in nursing, I mean sa ano pala, in nursing, diagnosis and treatment of human responses to actual or potential health problems. Okay, when we say diagnosis, yan yung problem na nakita natin sa patient. Okay, say for example, si doctor, ang nakita niya na problem kay patient is meron siyang congestive heart failure or COVID-19. Okay, pero sa atin, sa nurses, we have our own diagnosis. Okay, it's called nursing diagnosis. Kung merong medical diagnosis, meron din tayo nursing diagnosis. The medical diagnosis is the disease itself. Okay, yung COVID-19, yung congestive heart failure, yung yung mga diseases like or like pulmonary tuberculosis. Okay? So, hindi pwede natin gamitin yung medical diagnosis na mga ganyan kasi tayo mga nurses, we also have our own nursing diagnosis. So, paano natin siya ma-formulate? Kung ano yung nakita natin objectively sa ating patients, yan yung gawin nating nursing diagnosis. Say for example, si patient nagka-COVID-19. Ano yung nakikita natin usually? Di ba? Nahihirapan silang huminga, tumataas yung kanilang temperature. So, for example, kung nahirap silang huminga, yung ating nursing diagnosis na dyan is the ineffective airway clearance or ineffective breathing pattern, ganyan. Okay, so sa ineffective airway clearance is kapag merong plema si patient, ayan, nahihirapang mag-clear yung airway niya. Okay? Ibig sabihin, or nahihirapan siyang mag-ubo, ganyan, ineffective airway clearance. Pero kapag ineffective breathing pattern, ganyan, minsan tumataas yung kanilang breathing, okay? Just because of the COVID, okay? So, ganyan yung mga nursing diagnosis natin. And actually, those nursing diagnosis can be found in a NANDA book, okay? Magkakaroon kayo ng NANDA book sooner or later, maybe on your summer, kasi mayroon na kayong fundamentals of nursing na subject, okay? And then, health problems can also be actual or potential. Sa nursing diagnosis natin, we have different health problems and it can be actual or potential. When we say actual, yun yung talagang actual na nangyari sa patient. Like for example, nakita natin si patient ng difficulty in breathing. Okay, then, yan yung actual, yung actual niya na problem. However, yung sa potential naman is, say for example, merong sugat si patient. And then, hindi niya hinuhugasan o hindi niya nilininisan. Okay? Mayroong possibility or potential na makaka-infect talaga or magkaka-infection si patient. So, the potential problem with that for that is risk for infection. So, we have to define, okay, ano yung mga actual or potential na problems sa patient. Okay? And kung ititimbangin natin yung dalawa, mas pipiliin muna nating i-address or isosolve yung mga actual problems kaysa sa potential problems. Okay? Kasi si potential, baka mangyari lang. Okay? Pero si actual is, nangyari talaga. So, kailangan natin i-address kagad or bigyan ng solution. Ayan, we have an example here like the fatigue. Okay? Fatigue meaning yung pagod si patient. Okay? Fatigue. Change in body image. Okay? Feeling ni patient. Kasi yung nursing diagnosis natin, pwede rin mentally yung mga problems na or emotion problems natin. Say, for example, change in body image. Halimbawa si patient na nalungkot siya kasi parang feeling niya masyadong mataba na siya. Ayan, wawala na yung kanyang self-esteem. Okay? Or maybe, after nung na-amputate si patient or tinanggalan ng paa, okay, pwede na rin yan maging potential na nursing diagnosis, which is change in body image. Baka mas mawala na siya ng confidence in life kasi isa na lang yung paa niya. Okay? Baka pagtawanan siya or maybe i-bully, ganyan. Activity intolerance, meaning hindi makatolerate sa paggalaw. For example, konting galaw lang, pagod na kaagad. Okay? Or parang hindi na talaga siya hindi niya kayang gumalaw. Almost the same as the fatigue, okay? Pero si fatigue, pagod lang siya. Okay? Si activity intolerance is hindi talaga siya, parang hindi niya kaya, okay? Na mag-initiate ng isang action. Okay? Yeah, so ang medical diagnosis is of course the disease itself, the heart failure. Okay? Yeah. So we have Jacqueline Fawcett. Okay, she is a nurse professor of the University of Massachusetts in Boston, USA. Okay, and she is also known internationally for her meta-theoretical work. Okay, so Fawcett's theory focuses on the nature and structure of nursing knowledge. It also focuses on teaching the discipline-specific knowledge. Like for example, the theoretical concepts that guide nursing practice like, ano ba yung mga discipline-specific knowledge in nursing? We have the anatomy, ganyan, pharmacology, okay, ganyan. Okay? And also, she analyzes and evaluates the nature of structure in knowledge in nursing and how knowledge formalized as nursing conceptual models or paradigms and theories. Okay, so in simple terms, inaaral niya lang yung relationship ng concepts and ideas and paano nila ma-formulate in the conceptual models and theories, which is through her proposition in making the meta-paradigm. Kaya niya nagawa yung meta-paradigm na yun. Okay? And then, models and theories can be used to guide nursing research, nursing practice, and the construction of educational programs and clinical agency administrative structures. So, sinabi niya rin nun na those theories and models can be used as guide to many aspects of nursing knowledge. Okay? Of course naman, kasi kaya nga nagawa itong theoretical from foundations of nursing kasi those theories that we will be learning are our guide, okay, in how do we, or ano yung mga approach natin in practicing in the clinical field or nursing area. Okay. Okay, we have here the philosophy. So according to Fawcett, the function of a philosophy is to communicate what the member of a discipline believe to be true in relation to the phenomena or interest of that discipline. It is also used to identify core phenomena of interest to the discipline. Okay, so when we say philosophy, it is the same or it is also just the same as saying na ito yung lahat ng mga fundamental beliefs mo or lahat ng beliefs mo in life. Okay? Lahat naman tayo mayroong sarili-sariling philosophy in life. Okay? So for example, ako, I have also this philosophy in life na don't chase success, but let success chase you. Okay? If you know that kind of philosophy or quote, kinakuha ko yan siya sa 3 Idiots. Okay? Maganda din naman kasi siya na quote or philosophy na don't chase success. Let success chase you. If you work smart, okay, if you're studying smart, then you do not have to work on your success. Si success na mismo yung lalapit sa iyo. Okay? So don't strain yourself too much, okay, in achieving a goal. Yan. So what are the areas of philosophical inquiry? Okay, we have the first one, which is the ontological area, which is the study of reality and what members of a discipline believe to exist. Okay, so when we say ontological or ontology, ito ay isang branch ng philosophy that studies concepts such as existence, being, becoming, and reality. Okay, ano ba yung pwede nating magbigyan ng example? The greatest example of this is that of kung ano yung concept of God. Okay, have you ever argued with a friend or family member about existence of God? Okay, so this is a very controversial topic, no? Okay, so this discipline focuses more on explaining something that we believe exists. Okay, so when we say ontology kasi, kung ano yung belief natin na exist, okay, we are using this kind of philosophy. We have this philosophy or idea na that God exists. Okay, and yung iba naman, they also have their own concept of God. Okay, pero in general, we only just have one God. Okay, so I will just not delve into too much into that topic kasi masyado siyang controversial. But this is just to give you an example. Okay, so sa epistemology area naman, it is a study of knowledge, okay, including how it can be created, disseminated, and characterized. Okay, kapag sa epistemology naman, this is the theory of knowledge. Okay, so answering an epistemological question should requires consideration of the relationship between knowledge, truth, belief, reason, evidence, and reliability. So, like for example, ano ba yung ma-example natin dito? Yung mga questions na, what is knowledge? Okay, how is knowledge acquired? Or how do we know what we know? Okay, commonly nagagamit itong area na to, or epistemology, kapag gumagawa tayo ng research. Okay? Of course, kung gusto mong matutunan kung ano yung mga feelings ng mga parents na aalaga ng isang child or isang anak na may special needs, okay, like for example, isang Down syndrome na anak, okay, kung gusto mo siyang malaman, paano mo gagamitin yun or ano yung gagawin mo para ma-acquire ba yun na knowledge, okay? So, ina-apply natin si epistemology na or epistemological technique or area, okay? So, ganyan. And then, we also have the ethics area, which is an inquiry about what is valued by a discipline in terms of actions and practices. So, ethics are the concepts of moral right and wrong, and the moral good and bad. Okay? Ito lang yung parang values natin or morals. Okay? For example, addressing the morality of abortion, mayroong ibang tao na pro-abortion sila, meron namang tao na ayaw nilang abortion. And also euthanasia, when we say euthanasia is mercy killing or yung kumukuha ng consent na to kill a person, okay? Because just to end yung kanyang suffering, and ganyan. Okay? So, usually, ini-inject niya na sila ng medication or substance na just to put them into cardiac arrest, ganyan, which is the potassium chloride. Pero with the consent, okay? And this is also controversial because some people would allow it, okay, yung euthanasia. However, there are other people also that would not allow euthanasia, okay? And also, we have the logic area, okay, which is a method of inquiry through which arguments are presented and evaluated. Okay, so sa logic naman, si logic is the study of reasoning or the study of principles and criteria of valid inference and demonstrations. So it also attempts to distinguish the good and reasoning from the bad reasoning. Like for example, one may say that there is no evidence that penicillin is bad for us. Okay? Because of that person na wala namang nangyari sa kanya as he or she uses the penicillin. Okay? Yung logic ng person which corresponds to his experience, okay, is correct naman kasi ginamit niya naman yun, okay, na-experience niya naman yun pero wala namang nangyari sa kanya. However, if hindi niya pala alam kung ano talaga yung effects ng penicillin in the longer run or kung matagal na siyang ginagamit, okay? So his lack of knowledge will make the argument invalid. Okay? Now we have the nursing scholars in philosophy, okay? What are those views no in philosophy? So we have the first one which is the reaction worldview. So this view is that humans react to stimuli in linear, casual manner and change only when necessary for survival. Like for example, this first one is the reaction view. Okay, it explains that individuals' behaviors are predictable or somewhat performs a routine, but it may only be changed in that if that person has to depend on its survival. Okay, so kung halimbawa na-threaten siya, mag-change yung kanyang behavior as to how or sa kanyang that corresponds to his survival. For example, a nurse is performing routine rounds, okay, and just carrying out the doctor's orders to the patient. Okay, however, sa pagra-rounds ni nurse, biglang nag-DOB si patient or nagdi-difficulty in breathing and kailangan mag-administer ng oxygen. And kapag mag-administer ka ng oxygen o magbibigay ka ng oxygen sa patient, kailangan ng doctor's order pero wala si doc. So paano yan? Magbibigay ka ba ng oxygen sa kanya or hindi? Okay, so kapag magbigay ka sa kanya, mawawala yung pakiramdam ni patient, okay, or yung kanyang paghirap sa paghinga. Pero kapag binigay mo naman yon na walang order ng doctor, baka ma-revoke yung license mo kasi we cannot do something that is not that has not been ordered by the doctor kasi yung oxygen administration should require a doctor's order. Okay, so matatanggalan ka ng lisensya. Okay, so na torn between the two decisions, which is to help the patient or to protect your license. Okay, but anyway, in the area we can administer naman oxygen in emergency situations like pero lang siya na mayroon lang limit kung ilan lang yung pwede nating ibigay. Okay? And then after nating ibigay, pwede naman nating notify kaagad si doctor, okay, because of the situation or emergency situation. We also have the reciprocal interaction worldview. Okay, in this view, humans are active, have reciprocal reactions with the environment, and may or may not change under certain circumstances. So, in reciprocal interaction worldview, it is believed that humans will give in return something that has been given or happened to him or her. Okay, so nagre-react tayo in exchange kung ano yung nangyari sa atin. For example, if a child is hurt, okay, or nasaktan si baby, okay, pwedeng response niya is, kanyang reaction is that umiyak siya kasi nasaktan siya, or maybe pwede yung reaction niya is to fight back, okay, papaluin niya yung halimbawa nabunggo siya sa table, para ma-comfort niya yung sarili niya, paluin niya rin yung table, ganyan. Okay. So this is the reciprocal interaction worldview. Okay, in simultaneous action worldview. Okay, so in this view, humans change continuously and are in mutual rhythmical interchange with the environment. Okay, so in this view, it is simply saying that change is constant, and kapag always nag-change yung environment, so as the person or so as we. Okay, so ganyan lang yung simultaneous action worldview. So now let's talk about the conceptual models. So what are the conceptual models? So these also called the conceptual frameworks, conceptual system, paradigm, and disciplinary matrix. Okay, so ito yung usually makikita ninyo or ginagawa ninyo kapag nagpapandak kayo ng research. Okay, So we have two. We have the theoretical framework or theoretical lens na ngayon in qualitative studies and conceptual framework naman in quantitative. Okay? So these are the set of relatively abstract and general concepts that address the phenomena or of central interest to a discipline, or the propositions that state relatively abstract and general relations between two or more of the concepts. Okay, in simple terms, no, conceptual framework maps out the actions or the actions required in a study. It is used to show relationships among the ideas and how they relate with each other. Okay, so I will be showing you an example here. Okay, so yung concepts or conceptual framework is composed of concepts that describe ideas about individuals, groups, situations, and events. Okay, so conceptual frameworks or models are composed of concepts that describe the ideas about someone or something. Okay, say for example, dito sa illustration natin. Okay, what are the concepts in identifying an adolescent, or you want to define adolescent as your target participant? Okay, we can have yung first na concept is the demographics profile, which is ano yung concept mo sa adolescent, ano dapat yung specific age niya. It can be 15 to 24 years old ba? Yan. And also, since you are talking about adolescent reproductive health, so ano yung yung civil status niya? Gusto niyo bang na yung married or yung single parent, okay? As your participant, okay? Pwede mo rin yan consider. Ganyan. Okay, and conceptual framework or model also characterize relationships among phenomena to shape a distinctive frame of reference. Okay, so those concepts can describe the relationships among ideas in order to picture out a framework as reference in giving more focus on what we want to study. Okay, etong mga concepts na to, okay, etong nandito, okay, ito yung dapat na i-consider ninyo, okay, or dapat niyong i-observe para mas clear yung inyong research about getting this topic or title, which is the Adolescent Reproductive Health Wellness Program. Okay, so ito yung purpose ng conceptual framework. Okay, now we also have here the phenomenon. So phenomenon means an aspect of reality that can be consciously sensed or experienced. So an example for this or examples for this for the meaning of phenomenon is that are the social systems, the health, perception, and interpersonal relationships. So when we say phenomenon, these are objects or aspects that are known through our senses rather than just our thoughts or opinion. Okay? Or rather than ating yung haka-haka natin. Okay? Um, they are something that is evidently happening. Okay? For example, kung sa social system, like our communities, our cities, college campuses, ganyan. Or sa health naman, okay, ang isang example ng phenomenon sa ating health could be like how we acquired the diseases like COVID-19, ganyan, so on. Okay? So phenomena are those things that are actually happening. So we also have the theory. A theory is one or more relatively concrete and specific concepts that are derived from a conceptual model. Okay, so theories are used in order to direct also our conceptual frameworks or models. Okay, para mas ma-firm pa natin yung ating argument sa isang study, kailangan nating ma-relate yung or ma-incorporate yung theory para mas maintindihan pa ng ating mga readers kung ano yung ginagawa natin sa isang research. Okay? So, theory is also a set of statements and tentatively describe, explain, or predict relationships among concepts that have been systematically selected and organized as an abstract representation of some phenomenon. So, when we talk about theory, okay, kung pag-usapan natin yung theory, it means that it is scientifically acceptable. Okay, phenomenon or body of principles. It can also mean na it is a belief or proposed of following or followed as basis of action, and also a hypothesis. Okay, hypothesis assumed, meaning yung theory hindi pa talaga siya totally factual. Okay, for the sake of argument. Okay, Yan, ang theory kasi mayroong mga set of assumptions, okay? Na para ma-define lang yung isang argument or mag-close lang yung isang argument, which are factual assumptions naman, hindi naman yung assumptions na gawa-gawa lang, di ba? Okay, so those are some educated assumptions. And an explanation for some phenomenon that is based on observation, experimentation, and reasoning. So a theory may also be an explanation for some phenomenon so that we can have basis or assumptions on how to or how a phenomenon emerge or is happening. It can be described through our observation, experimentation, and reasoning. So lahat ng mga theories natin, our like yung kay Florence Nightingale na environmental theory, adaptation theory, okay, um, lahat doon merong mga different assumptions and we will be talking those later on. So ano ba yung mga components ng ating theory? We have the concept, the definition also, and the assumptions of proposition. These three no na part would define a phenomenon. Okay? And yung phenomenon na yun would turn out into a theory. So a theory must have concepts, definitions, assumptions to describe a phenomenon. Okay? So ano ba yung definitions na ibig sabihin doon sa may theory doon sa dito sa diagram na ito? Okay? Ano ba yung meaning niya nun? Okay, so definitions can be or they convey the general meaning of the concepts in a manner that fits the theory. So the definitions now can be described as the actual or yung totoong meaning of the concepts that should define depending on how the theory works. Okay, for example, yung meta-paradigm, okay, magkakaiba-iba yung meaning ng person, ganyan. Health, environment, and nursing in each theory. Okay, so definition is also or can be also describe activity necessary to measure the construct relationships or variables within a theory. So definition in a theory would describe the activities within a relationship of variables in order to give clarity. Okay, para mas masyadong clear and makapagbigay ng focus on ano ba talaga yung theory is all about. Okay? Now we also have here the assumptions. Ano ba yung meaning of assumptions? Assumptions describe the concepts or connect two concepts that are factual. Okay? Assumptions in the theory are statements that are accepted and as given proofs. I mean, given truths pero walang proof or without proof. Okay? From the root word itself na assume. Okay? Nag-assume lang tayo pero it can be or parang close to truth pero hindi pa siya ma-taken na truth. Okay? So, it is said to be taken for granted. Okay? So, taken for granted statement that determine the nature of concepts, definitions, purpose, relationships, and structure of the theory. So, bakit taken for granted? Because yung theorist kasi pwede siyang magbigay ng mga assumptions or mag-assume however he or she likes as long as acceptable yun siya and naka-anchor sa kanyang theory. Okay? Okay, we have an example of assumptions here. We have Levine's conservation model. Okay, so kanyang assumption dito sa kanyang model is that individuals continuously defend their wholeness and adaptation is an ongoing process of change and nursing is human interaction. So dapat kung nag-nursing tayo, dapat it involves caring our patient or human interaction. We interact with our patient. Okay, and then also, nurses promote wholeness through the use of conservation principle. Okay. When we say conservation kasi, it means na keeping together of the life system or keeping our own integrity or our wholeness. Okay. That if individuals continuously defend their wholeness, okay, or yung kanilang dignity or kanilang pagkatao, wholeness exists when the interactions or constant adaptations to the environment permit the assurance of integrity and also kapag may threat, nandito pag may threat sa kanyang integrity, meron na si adaptation, which is an ongoing process of change whereby individuals retain their integrity within the realities of their environment. Okay, for example, meron kang if you are an achiever sa school no dati or how maybe now, okay, an individual who is an achiever, to achieve his wholeness, he will do everything, okay, to maintain his title as the top achiever in school. Okay, masyadong competitive. Okay? However, his integrity may be threatened if a top achiever from other school transferred to his school. Okay? Merong top achiever, halimbawa sa Ateneo, nag-transfer dito sa Notre Dame, ganyan, na-threaten na yung kanyang wholeness as or yung kanyang title to become a top achiever. Okay, so para ma-adapt siya or ma-adapt niya yung ganitong threat, the person will adapt by studying even harder in order to maintain his status as the top achiever of the school. Okay, mas magiging ano pa siya, mas magiging masikap pa siya sa pag-aaral para hindi lang talaga mawala sa kanya yung title na maging isang top achiever ng school. Okay? We also have another example here, which is the King's Goal Attainment Theory. Yung kanya assumptions dito is that human beings are focused of nursing, goals of nursing care, ano ba yung mga goals natin? Okay, we have the health promotion, maintenance, and restoration. Okay, and the care for the sick or the injured, and care for the dying. Okay, yan yung mga goals natin in theory. I mean, goal attainment theory. Okay, and we also have the different systems here. We have the personal systems, interpersonal systems, and social systems that we should consider in achieving this goal attainment theory. Okay, ano ba yung personal systems? These are individuals which are open, total, unique systems in constant interaction with the environment. Okay, so interpersonal systems naman, these are two or more individuals in interaction, and sa social system are yung large groups with common interests or goals. Okay, so what are the characteristics of a theory? Or ano dapat yung isang theory would all about? Or ano yung theory that should possess? Okay, the theory is used by practitioners to guide and improve their practice, of course, as I have mentioned earlier, no? And it is also consistent with other validated theories, laws, and principles. Kasi yung mga emerging na theories kasi, pwede kasi sila maging basis to make another new na theory. Okay? Na consistent din dapat sa isang theory na na-validate na or legit na published. Okay? And it is also basis for hypotheses that can be tested and general body of knowledge that can be researched, implemented to validate them. Okay? Kaya siya ginagamit dun sa ating research or study. Okay? However, sa nursing theory naman, ang kanyang characteristic is that it has a set of concepts, definitions, relationships, and assumptions or propositions derived from nursing models or from other disciplines. Okay, so theories are made and can be used to guide practice or even making efforts to improving it, which is why when a person conducts a study, that researcher should have a theoretical framework to define a basis on what the concept of his study yung sinabi ko. Okay? Kung halimbawa in the future gagawa kayo ng qualitative na theory qualitative na study, then you may also want to have a theory. Okay? Ganyan. Ayan, we have the three components here. We have the nursing practice, nursing research, and nursing theory. And with that nursing theory, ma-apply into practice. And kapag may discrepancies or may na identify or na-discover during the practice na baka nag-contradict sa knowledge, then we can apply and research for that. Okay, after that research, then pwede naman mag-formulate ng another theory. Okay, which is mas refined na siya and polished. Okay. Yeah. So ano ba yung mga purposes ng nursing theory? So in practice or kapag application na tayo sa or application of our knowledge in the area, it assists nurses to describe, explain, and predict everyday experiences. Okay, the nursing theory can also serve to guide assessment, intervention, and evaluation of nursing care. Okay, and it also provides for a rationale for collecting reliable and valid data such as yung health status of the patient, essential for effective decision making and implementation. Okay, so for example, if you want to apply the environmental theory, yan, magkakaroon ka talaga ng mga decision making on how to modify the patient's environment, internally or externally. Okay, they also help establish criteria to measure the quality of nursing care and help build a common nursing terminology and enhance the autonomy of a person. Okay, so yan yung purpose ng nursing theory in practice. In education naman, it also provides a general focus for curriculum design and guide curricular decision making. Okay? So, halimbawa, yung nursing theory natin, um, yung sinabi ko na ginagamit natin siya sa research, ganyan. Okay? So, it can also provide a focus kung ano yung study natin all about. Okay? Yeah. In research din. Okay, it offer a framework for generating knowledge, so as what I've said, and assist in discovering knowledge gaps in specific field of study, and offer a systematic approach to identify questions for study, select variables, interpret findings, and validate nursing interventions. Okay? So, ganyan ka-importante si nursing theory. Okay, kasi marami siyang purposes in practice, education, and in research. Now we also have here the middle range theory. So what does middle range theory means? So these are generated or tested by means of research and are used as evidence for practice activities such as assessment and intervention. So nag-emerge itong theory na to and is used para mag-acquire ng evidence through research. Okay? Nag-emerge siya kapag halimbawa yung isang theory ginawa ng isang research kasi may na-identify na gaps within the theory. So ayan, na-emerge itong si middle range theory. And these theories can be used as evidence kasi nakapag-identify na yung gaps within the theory na yung ginamit niya as basis. So pwede na siya maging evidence din. Okay, in future researches, okay, na formulate within that theory. So we have here the categories of middle range theory. So the first one is yung descriptive, or which is an information presenting. So it describes, or from the word itself, the descriptive, no, it describes or classifies a phenomenon or one concept. Okay, for example, if you want to identify, or to define the relationship of a person who is sexually abused to her friends, no, you want to define kung ano na yung kanyang behavior towards her friends. Okay, so you may also use this kind of category, which is descriptive. If it describes, it simply names the commonalities are found in discrete observation of individuals, groups, situations, or events. It is generated and tested by means of descriptive research, which may be quantitative or qualitative design. Okay? So, from the word itself, no, kapag gumawa ka ng research na descriptive, you're just describing a phenomenon. Okay? And why does this phenomenon happen? Okay? So, ganyan yung descriptive. If halimbawa naman you are using descriptive, okay, to classify, it categorizes the described commonalities into mutually exclusive, overlapping, hierarchical, or sequential dimensions. It can be also referred to as typology or a taxonomy. Like for example, yung kay Peplau na theory of interpersonal relations, which are the four sequential phases in the nurse-patient relationship. Ano ba yung phases ng nurse-patient relationship? Of course, kapag halimbawa si nurse, bago niya lang na-meet si patient, then they will have the orientation phase. Okay, ano ba yung orientation phase? Yung getting to know each other muna, ganyan. Nire-review ni nurse yung information ni patient, okay, para mas makilala niya si patient, ano yung mga problems niya. Okay, now so we also have another phase after the orientation phase, which is the working phase. So working phase naman is yung kanilang they are already interacting with one another, nagde-design na sila kung ano yung care plan na gagawin to address the problems of the patient, ganyan. Okay? So working phase is also comprises of two phases, which are the identification phase and the exploitation phase. Okay, kung sa identification phase, okay, yan yung pag-identify ng mga problems. Okay, kung isa-select ni nurse and the patient kung ano yung i-address ng mga problems para masolusyonan. And kapag after na na-identify, proceed na sila sa exploitation phase. Sa exploitation phase naman is doon na yung nangyayari yung actual na solution or ginagawa ni nurse para ma-address yung solutions sa or ma-address yung problems ng patient. Okay, paggawa ng solution as they have agreed. Okay, ganyan. And sa last naman, okay, pag natapos na lahat, okay, and then after, if natapos mo na yung, um, or na-goal met mo na uh, yung mga goals mo, okay, and na-address mo na lahat ng problems ni patient and ready to be discharged na siya, then you have the resolution phase. Okay, so resolution phase is you give up na yung hindi naman yung totally you give up, pero you are going to you're going to make the patient be reliant to himself or herself, or to practice self-reliance or independence. Okay, magiging independent na si patient, and without the care na ng nurse, kay kaya niya nang solusyonan niya yung kanyang mga problems without the assistance of the nurse. Okay, so ganyan yung apat na phases in Hildegard's Peplau's theory: the orientation phase, the working phase, which are the identification phase, exploitation phase, and the last phase, which is the resolution phase. Okay, we will be discussing those more in detail later on. Okay, as we start with the theories, our nursing theories. Okay, if you are going to use the explanatory naman, which is it is knowledge building. Okay, when we say knowledge building, you are going to make or to explain something na para mag-create ng isang concept or idea or knowledge. Okay, um, if you're going to use the explanatory, you have to describe or explain the relations between two or more concepts, and also explains why the extent of to which one concept is related to another concept. Okay, and it is generated and tested by means of correlational research, typically quantitative design, and an example for this is Watson's theory of human caring. Okay, okay, so I remember no na may nag-ask sa akin one time na ano daw yung difference ng environmental theory compared to Watson's human caring. Okay, as what I have also said nung dati na environmental theory is more focused on changing the patient's environment towards the patient's or to enhance the patient's recovery. Pero si Gene Watson is that um, nag-formulate siya ng kanyang theory, which is the human caring. So kanyang focus is more on care. Okay? Kung ano ba yung mga caring approaches. So she also have made some curative factors, okay? Which are 10 curative factors. And dapat itong 10 na curative factors, dapat ma-observe ito ni nurse para um, maano ma ma-achieve niya yung goal ng human caring, okay, or to maintain the wholeness of the person, so that he or she will be also become um, fast din sa kanyang recovery, or magiging good yung kanyang recovery. So if you want to use this explanatory, no, you want to explain lahat ng mga factors na yon under human caring ni Watson, and ano yung mga relation niya towards achieving the theory, which is the human caring. Okay? So, ganyan. Next is the predictive, okay, or knowledge confirming. So, it is an explanation to the prediction of precise relations between concepts or the effects of one or more concepts. It also addresses how changes in a phenomenon occur and generated and tested by means of experimental research and quantitative in design. So the best example for this is yung Orlando's theory of deliberative nursing process. Ano ba yung nursing process? Okay, we have um, 5 phases of nursing process, or the ADPI. Okay, I will just write it here. Sorry. ADPI. Okay. ADPI. Okay, what does A mean? A means assessment. Okay, assessment. And then D is for the diagnosis. Diagnosis. Or dapat yung diagnosis natin should not be medical diagnosis but nursing diagnosis. P is for planning. Okay? After ma-identify natin or ma-diagnose yung problem ni patient, then we have to plan something para ano yung steps na gagawin natin to make a solution on the patient's problem. And then I is for implementation. Implementation or yung intervention. And the last one, or yung implementation or intervention, is yun na yung mga steps na ginagawa natin. Okay? Which is nakaplan na natin, or yung na-plan natin, and yung mga actions na dapat nating gawin to address that problems. And last is the evaluation. Evaluation. Ang evaluation naman is yung end result or yung outcome natin sa pagbigay ng care kay patient towards his or her problems. Yung evaluation natin should be is classified in three. First is the goal met, next is the goal partially met, and the last one is the goal not met. Kung hindi mo na met or kung hindi mo na-achieve yung goal na tanggalin yung problem or i-address yung problem ni patient, then then your evaluation will be goal not met. Kapag na goal not met ka, uulitin mo naman yung nursing process mo, okay? Or yung nursing care plan mo, okay? This is actually used commonly in nursing care plan or your NCP. And you can actually do this if meron na kayong NANDA book, okay? Kasi doon kasi natin makikita yung diagnosis natin sa NANDA book. And nandun din lahat ng planning, implementation, and except for evaluation. Okay? Yung evaluation nakadepend yan sa response na ginawa natin kay patient. If na-meet ba natin yung goal natin or hindi. Okay? Ayan. So, sa predictive, ganito yung nangyayari. Okay? We are predicting and depending on also dapat kung ano yung ginawa natin na actions, kung effective ba siya, then our prediction towards the evaluation is that it should be good or na-met natin yung goal. Okay? And we also have the last one, which is the prescriptive or knowledge utilizing or knowledge or the use of knowledge. Okay? So it is concerned with guidelines that describe what to do in order to achieve specific outcomes and address a specific phenomena and reflects practice and sometimes derive from experience. Okay, so we are after we experience something, okay, or we have gathered something information through experience, then we use that experience to make a knowledge, okay, or to have knowledge, okay. Yan sa prescriptive. And then details nursing interventions for a specific phenomenon and the expected outcome of the care, linked to outcomes, consequences of specific nursing interventions, and have instructional design. So this is under the prescriptive or the knowledge utilizing. Okay. Yeah. So we have here the different knowledge structure levels with examples. So for example, yung meta paradigm structure level in meta paradigm, example niya is the person, health, environment, and nursing. In philosophy, yung philosophy Nightingale, which is yung to modify the patient's environment. Okay, conceptual models. We have the Newman system model, any model, yung Levine's conservation model kanina. Okay, theory, Newman's theory of optimal client stability or environmental theory ni Florence Nightingale, and the last one is the middle range theory, which is the Newman's optimal client stability with structured activity in a community setting for healthy aging. So ito na yung mga nag-emerge, okay, na theories because they have already identified the gaps, okay, in those kind of theory na study niya or na study ng isang theorist. Okay, so kaya siya gumawa ng bagong theory. Okay, so that concludes my discussion about the structure of nursing knowledge, and we will be talking about the different nursing theories starting today. Okay, so I will be tackling first the Nightingale's theory, which is the environmental theory, on the next video. Okay, so thank you for listening and goodbye.